The Robert Wood Johnson Foundation released national data in October that found 1 in 6 young people between the ages of 10 and 17 have obesity. I went to a local school garden that encourages children to learn about food and healthy habits from as early as 5th grade. Garfield's Garden on the Corner, a place growing healthy eating habits.
It's a way of instilling the habit young, rather than more modification and having to work on those habits later.
From planting a seed to washing the vegetables, students at Garfield Elementary School are exposed to how food grows, how to cook with it, and ultimately get to eat it.
Then they actually get to see it in the school cafeteria on the menu, which is really exciting. And it also promotes just local food, healthy soil, and that just creates more nourishment for the students.
Paige Mullen is president of the Mullen Foundation, which started in 2008 because they saw childhood obesity turning into a public health crisis.
At the same time, schools were eliminating funding for physical education, and so there was an elimination of PE and recess. And so initially we started by getting kids moving, and then we integrated some nutrition education.
Jamie Bissell with the Robert Wood Johnson Foundation says, like so many things, COVID-19 has impacted childhood obesity.
In many ways, the childhood obesity epidemic and the COVID-19 pandemic have exacerbated one another, and that childhood obesity really is a symptom of all the larger challenges that families face in their communities, and it's a sign that our policies are failing our kids.
Bissell says compared to the national data, Arizona statistics on childhood obesity are significantly lower. Nationally, more than 16% of children are considered obese, but Arizona's rate is just over 10%. That's 6% lower than the national average. Bissell says Arizona is doing something right.
Arizona should certainly celebrate. Arizona is 50 out of 51 in terms of, doing the best.
Bissell says there's still a lot that can be done in both policy and practice, but she says it is a good idea to start healthy behaviors young.
I think we need to be thinking bigger and bolder about lasting solutions to ensure that every child in America has a fair and just shot at growing up as healthy as possible.
And for the young kids at Garfield Elementary School, Mullen says they are excited, work together, and apply what they learn.
When you see them sharing that with somebody else and kind of mentoring somebody else, that is, it's really beautiful to see that.
Not enough activity and too many calories from food and drinks are said to be the main causes of childhood obesity. Limiting screen time to 2 hours per day and replacing soda with water are just 2 examples of healthy habits.